hold on to December 1.
Recording in progress.
Well, good afternoon, everyone. I want to welcome all of you to the San Luis County Board of County Commissioners acting in its capacity as the Board of Human Services. It is now 1:01. Today is Tuesday, June 17, 2025. We're going to call this meeting to order. Please rise for an invocation by Commissioner Tony Haas, followed by the pledge of allegiance by Commissioner Robert Lucero.
Dear God, thank you for the opportunity to see this new day. Please help us to overcome any hurdles we may encounter. Give us the wisdom and guidance in everything we do today so we may honor you with our words and actions. All this we ask in the Lord. Amen.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioners. Roll call, Mr. Aragon.
Commissioner Lucero?
Here.
Commissioner Haas?
Here.
Commissioner Lopez?
I'm here. Approval of the agenda. Do we have any changes to the agenda?
None at this time, Commissioner.
Thank you, sir. I will entertain a motion to approve the agenda.
Move to approve the agenda.
A second.
Commissioner Haas?
Yes.
Commissioner Lucero?
Yes.
Commissioner Lopez?
Yes. Before we get into the next item, thank you so much. Thank you for all the work that you do. And again, as always, much appreciated. The community, we know that is being served well. And thank you for keeping those smiles. You know, we not often get an opportunity to celebrate in this position, but to all, Mr. Aragon, to you and your team, job well done, and congratulations on all the services that you provide for our community. So, having said that, we're going to go to section 2. We can do this individually or as a group. We have May 20th, 2025 regular meeting minutes, June 17th regular meeting minutes, and July 15th regular meeting minutes. Have had an opportunity to read them, Commissioners. Any questions, any additions, deletions, corrections? Hearing none, I will entertain a motion to approve those 3 items in one motion.
Commissioner, before we do that, I have a quick question for our secretary. Because 2 of these meetings, both Commissioner Haas and Commissioner Lucero were not present for certain ones, is it okay to give us
Each of
consent?
them had one meeting. They were, Bob wasn't here for the May, I believe, Tony the June, and Felix the July, if I remember right.
Well,
So
I'm
each of
glad
them
that
had one.
Thank you for that. Thank you for that. So let's do this individually. So the May 20th, 2025 regular meeting minutes, Commissioner Lucero was not present.
Correct.
So I will make a motion to approve those May 20th, 2025 regular meeting minutes.
Second motion.
Commissioner Lopez?
Yes.
Commissioner Haas?
Yes.
And for the June 17th, Commissioner Tony Haas was not here. So the regular meeting minutes, I will entertain a motion.
I'll move to approve June 17, 2025 minutes.
Okay. Commissioner Lopez?
Yes.
Commissioner Lucero?
Yes.
And on the next one, I'm going to abstain from voting on July 15, 2025 regular meeting minutes. I will entertain a motion.
Move to approve the July 15, 2025 regular meeting minutes.
I'll second that.
Commissioner Haas?
Yes.
Commissioner Lucero?
Yes.
Thank you, Ms. Lucero, for bringing that up to our attention. That's always very good. And at this time, we come to that section of the agenda where is public comment. Anyone online or here, you will have 3 minutes to come and address the board. Any one of you. 3 minutes. And so for
Phil's online.
anyone online. So here and now, there is no public comment. We're going to go into the director's report. Good afternoon, Mr. Aragon.
Good afternoon, Commissioners. Well, just a couple of things. One, I wanted to bring, we finally yesterday received our plaque. At last month's meeting, Commissioner Lopez, you were not here, so I was glad this came in time. I wanted to actually put it as an agenda item to, again, acknowledge and celebrate, but Los Angeles County received their CSTAT award for the 2024 Distinguished Performance for our county, so I would definitely, before the end of the meeting, love to get a picture with the board and our recognition So thank you to the state, and thank you for last month celebrating that with us. And unfortunately, we weren't here, but we had the state do a presentation on that, and I'm kind of go over the details of that. So again, thank you to all of my staff, although it's a short crowd today, but they're all instrumental in getting us to that level of performance. So I want to thank my staff publicly for the work that they do every day.
Absolutely, thank you, and mighty staff, and we keep up the good work, and certainly well deserved. Thank you. So,
Commissioners, in addition to that, I sent an email out early last week regarding a concern on SNAP allocation. There was a state email that came out just for clarification on that. The county directors were informed that there was we know that there's a SNAP ceiling component applied to the state as a whole. Normally, there's a buffer of about $1 to $2 million in that range, above or below that cap. In last week's email from the state, the correspondence was that there was a $12 million overage on the SNAP ceiling, and it kind of sent a lot of folks into panic, and I'm not sure if other commissioners were calling other commissioners about that, but it was concerning. We did get additional notice, which I updated the board with, and that was just to confirm that it was not in fact a $12 million gap there. It was a accounting clerical error that produced on the formulation or the formula of that calculation a incorrect number. So we are sitting at about $1.2 million overage, which is pretty standard for the state as a whole. So there is no concern to counties at this point with SNAP allocation that there's a county only component.
and based also there was a meeting with the legislative representatives for the special session. And one of the individuals that provided information to all of us was under Free Colorado. As far as using about Commissioner Tony Haas did a presentation earlier today on this initiative to increase basically two line items. One, healthy meals for all children in Colorado, and the other one, SNAP. And so that is going to be one of the conversations that's going to be picked up, I would think, on this very beginning of Friday.
So there is a legislative measure that's going up in front of the special session. I believe Commissioner Lopez, I forwarded that draft to you to review. There is specific tax revenue that they're looking at increasing to allocate towards both the SNAP program and the Healthy Eating Initiative, specifically with our free and reduced school lunch program. I reviewed that statute or legislative measure that's going up, and in context, it's a great program, and I think it would do great to fund the system. My only concern that I shared with the Human Service Directors Association is that that legislative measure does not clearly define that once that funding has been utilized towards those specific programs, if there's any excess, how does that benefit counties? There's no clear language that counties, it states that the state will be at their discretion to utilize that excess funding. That is concerning for us as counties. So of course, when I read that legislative measure, that's the very first thing I pick up, and I'm questioning why are counties not clearly defined in that legislative measure. We've seen this historically with other initiatives, and the counties end up having to foot the bill for unfunded mandates. So that is my only concern with that legislative measure. I'm appreciative for the office that drafted that bill, but I definitely think it needs some fine tuning, and counties need to have more of a voice in that legislative measure.
Commissioner Tony Haas said he could explain this so well, because basically that was the question that we asked all the way around. My two things that I actually, when we had the roundtable meeting with the legislative representatives, two senators and one state representative, is who is going to manage the fund and what's going to happen to any excess revenue if the voters approve this ballot initiative. And I'm going to yield the floor to Commissioner Tony Haas, because I know he as well made a big argument on that, and for that, thank you, sir.
Yeah, 70 million allocated to the program out of 120 million, so 50 million is going to administration. And then any overages go into the reserve. And my question to them is, are there any assurances that those reserves will be solely spent on SNAP, or will it be swept to help balance the budget? And there was 30 seconds of awkward silence on the line, and then they said, you know, we do have the state does have the opportunity to use those funds as needed. And so there's your answer.
Yeah. And that's primarily the concern that I communicated to the association. I've not heard back from Heather Durasco with the Human Service Directors Association, but I think that it's a very important piece that excess funding is identified clearly as to what it's used for and where it's allocated to. We know that there's an overspending at the state level and at the county level of county administrative funds. The JBC historically has thrown a few extra $1 million when available to that, but it has not been substantial enough to conduct the workload that we're doing. In regards to upcoming HR1 changes, correct, we've talked about that there's duplicate or double the workload coming with the 6-month renewals on SNAP and Med. There is no funding to support that. So my question to CHSDA was, can that funding be reallocated to the county admin line item in order to support counties with the added expenses? Again, I think these are important discussions that we need to be having during the special session, that legislative measure is not passed without clear definition as to those excess funds and how they're spent. But it will take all counties and commissioners to really push that initiative, and I'm hoping that, I know from this board I'll have that, but I'm hoping other county commissioners are also in that same thinking pattern in regards to that measure that's coming up.
And I truly believe it's going to pass, of course, the special session is going to be approved. It's going to come out to go to the voters thereafter, because it's, yes, it's a worthy initiative. We'll go back to who's going to be the custodian of the funds, and at the end of the day, what my comments to the group were, meaning the legislature should not have access to those funds to appropriate and move as a line item for balancing any other obligations of the state.
Now, on that specific legislative measure, though, the funds are clearly defined that CDHS, who is the SNAP administrative program oversight, will be the entity that holds that. The question is, will CDHS have clear either rule or understanding of the use of those funds beyond that? Because what we traditionally see is that the balance of state counties, which are outside of the big 11 counties, tend to be the ones that spend the majority of administrative funds. They are the ones that use more than the big 11 combined. When those balance of state counties, which includes rural and frontier, which is us, are underfunded, it puts a heavier strain on our agencies and on our county books than in big 11. Big 11 have fund balances of, $130, $400 million, depending on which county you're in. That's not what we have here. We have a healthy fund balance for the size of agency that we are, but it could easily be exhausted, and we've talked about that with the CCAP program. Additionally, we still have not received anything on that end. There's been a federal request made at the state level to disengage the prior legislation that was put in place for the child care program, the CCAP program, under the Biden administration. If they repeal that, that's great, but it's only going to hit the administrative funds. It does not change the fact that federally we are still mandated to meet the provider rates. So we still have an overexpense in CCAP programming as well. So there's a lot of concerns with how counties that are small and rural are still going to meet these mandates. If that funding is available, great, but it needs to clearly come to the counties that require that funding.
And I think, my point of clarification, that would be, CDHS is going to be the manager of the funds, but they might be related to the state. And
correct, and they might be able to pull from there too. We don't know.
And that is what I don't want. We don't want to see any supplanting of. And it's really easy to do. Simply release some of the funding from the state because CDHS has excess fund balance.
And even if it is clearly defined that counties will benefit from those excess funds, the other thing is that the current county administrative funding model If that's utilized, that still does not necessarily meet the need of the SNAP program mandates that are coming, because there are small and medium-sized counties that have significant SNAP administrative costs over the larger counties in proportion, if you look at that. And so will those funds be divided based on the traditional county admin allocation model? Or will there be an attention to the fact that these are added workloads in SNAP? That's the other question that I have, and that's where my concern lies with, again, how these funds are going to be managed and or distributed if the counties are in fact going to benefit from them. So that's really all I had for updates, because I really wanted to make sure that the board was aware of those. I know we're heading into special session. This is a unique situation. I've spoken to many directors who have been around for a long time. This is the first time that there's ever been a special session that was clearly focused on human service initiatives. So it's a huge step in the right direction, but I don't necessarily know if it's going to yield the results that we truly want unless we're at the table truly screaming at them about it.
We'll leave it at that. Thank you, Mr. Aragon, as always. Thank you for that information. We have a presentation, Division of Child Services, IMBACS program.
I will ask Ms. Tina Dorr with our child support program to come up and talk about our impacts program.
Good afternoon.
Hi.
Go right ahead.
I was lucky enough to go to the child support conference this year, and I was able to get into a session with a lady who runs the impacts program at the state. And I got in touch with her after the conference, and I kind of built a program, and we're going to get in touch with her to try and get a program started here in Los Animas County, and it's to utilize funds to remove barriers to employment. And kind of came up with the name AROSE, which is Assistance with Removing Barriers by Optimizing Supportive Services to Gain Employment. And the drive behind it is, so according to the Annie Casey Foundation, single-parent families are more likely to live in poverty. A large body of research shows that kids grow up poor and are more likely to experience physical, mental, and behavioral health problems, disrupted brain development, poor academic performance, employment challenges in adulthood, and more. So, how do we want to fix it? What do we want to do? So, we hear a lot of reasons why the non-custodial parents can't pay their child support. I don't see my child. I don't have a car. I can't get the money to get gas, or I don't have a diploma. So we want to try to help remove these barriers. So we've come up with quite a few resources and ways to help remove those barriers. And our long-term goal is to get more consistent payments to the custodial parties and gain compliance. So the next slide after the barriers, our long-term. So this is introducing, EROs. This is our long-term goal, is to decrease barriers to employment and increase consistent child support payments across non-compliant NCPs. So I had the opportunity to go visit Arapahoe County. They have a Parents to Work program, and they were, after 10 years, they collected this data, and over a 10-year period, overall in Colorado, child support payments decreased by 9%. But utilizing their Parents to Work program, their county actually increased in 11% in collections over that same time period. So we believe that we could probably get the same results.
So that's a 20% swing.
Yeah. And so I don't, there's a lot of information in this. If you like, I can read the whole thing to you.
We have time.
Okay. I can read it to you. So this is our basic scope. The AROSE program is designed to give non-custodial parties a helping hand through referrals and supportive services. Services will be limited to enrolled participants who are actively participating in the program. The goal is to assist in removing barriers to employment and support sustained employment resulting in consistent child support payments. There are acceptance and compliance criteria, along with criteria to remove an NCP from the program if necessary. The NCP must agree to use the assistance for the stated purpose and place designated at the time of issuance. The AROSE program will assist with services and referrals for mental health, employment services, budgeting classes, gas, funds for supervised visits, mediation for the NCP, professional licensing testing, GED classes and testing, funds for work clothes and shoes, one-time phone and 1 month of service, funds for glasses, funds for driver's license reinstatement, laundry assistance, vehicle maintenance assistance, car transportation pass, rental assistance for felons, funds for tools, funds for emergency situations, and other needs that may arise that are deemed necessary by the program manager. The NCP is expected to remain in the program for 2 years unless the case is paid off or closed in that time period.
So Tina, before you go to the next step, this sounds like a very good program, and I think, obviously, it is a huge impact. Arapa already proved that it works if you apply it properly. What, I know probably partners, and there's a liaison that works with the workforce center, and education, the college, continuing education, adult classes, that kind of thing, retraining, retooling. My question, having said all that, is do you see as we go into able bodies having having to go to work, would this be also kind of an offshoot of the same thing?
Yes and no. If they're currently in an open child support case or an arrears case, yes. Or if they're a TANF client under Colorado Works programming that works with child support with an open case, then yes. With AVODs, one of the things that we just got notice yesterday, so Los Angeles County has traditionally always been under a waiver for the work requirement portion of AVODs, able-bodied adults with disabilities. That waiver based on HR 1 is now nixed. There is no more waiver, and so us, Huerfano County, and about 17 other counties were cut from that waiver, which means there will be a work requirement now. So we are looking at how, if this program is something that we're engaged with these NCPs on, that we can in fact support them through AROSE here in Los Angeles County.
How many NCPs do you currently have?
Overall, or just?
Overall, just roughly through the agency.
We have about 800 cases, but some of those are NCPs with multiple cases. Do you know how many actual NCPs we have? I would say probably close to actually like 600 NCPs, would you say?
And so here is to me a bit of a dilemma. 600 workforce engagements, and where are the placement locations, which becomes another challenge for the agency, correct?
Yeah. It's going to be a challenge either way, whether it's in regards to the AROSE program here in Los Angeles, or if it's the work requirement for SNAP and food. With SNAP and food, that's a little different though, because we can count volunteer worker community service for those individuals who are disabled that cannot work a physical labor job or any kind of position full-time or even part-time. There is that option. We still don't have clarification on those pieces from the federal government. The federal partners haven't really clearly defined what is that going to look like to the state yet. We're still waiting that. It's going to be a challenge either way. What our hope is, and I think in fact with the Impacts program in the north, you're talking about a county that has probably close to 6,000 NCPs with cases, right? That 11% is a small margin, but that take up means that we are doing less administrative work in the child support division, with that group of individuals that are bought into the program. So it does, in effect, reduce costs in a sense for us because we're not spending as much administrative time on trying to engage and enforce those current child support orders.
I'd like to say that if you're looking at the concern of 600 non-custodial parties, a good portion of those non-custodial parties are paying non-custodial parties. So we're not looking at the full 600.
That's true too.
So there should be a concern there because we're probably looking, just because I know numbers.
I don't know how.
You're probably looking at more on the top part, the 150.
Okay, there.
So,
Now that
Yeah.
initially I began to say, wait a minute, how do we get
No.
there?
So, yeah, we went through the numbers and we so the people that would be good candidates for this program are actually around 75.
I find some similarities. There we get to part of the interruption, but go ahead and proceed.
We kind of went through the numbers just as a good guesstimate of who would be a good candidate for this program right now, and there's about 75 candidates.
Very, very. Now that is workable.
Yeah. So, yeah, currently we have roughly 75.
And let me ask you, you probably already have this, given the numbers, the cost to implement.
So right now, there is a grant. It's the Impacts Grant, and it goes through fiscal year 26-27. And Los Animas County will be asking from Impacts $1,200 per NCP, and Impacts also pays for the technician. Did I write the amount? I think I brought that here.
Oh, okay.
Maybe I did. No, so Impacts pays for $1,200 per NCP, and they pay for the position, the technician, to work the cases. So the county actually doesn't pay for anything through fiscal year 26-27.
So on that then, Mr. Erica, what your county administrative cost, will you be needing more FTEs or the current personnel that you have will be able to implement, deploy, and supervise management programs?
I think initially when Impacts came out, the counties that are utilizing it were utilizing the workforce they had. I think through time and engagement with the program, there's obviously probably been more folks brought on board with that. This is substantially new for us as a program, so we're going to have to assess that. Additional to that, though, it's also a matter of, we've spoken with the Impacts program at the state level beyond the granting period, is what does that funding support look like? Was it Jefferson County that's using TANF reserve funds? Arapahoe. But they're not the TANF reserves that we're familiar with. There's this offset portion from the state legislatively that's held that we can tap into those funds as well, and that's what we're trying to clarify with them. There would be a formal agreement that we'll bring in front of the board for the program before any initiation of this, to hammer those out and make sure that that agreement with the state is concrete as to where the funding streams are coming from. But ultimately, according to Arapahoe, I don't believe they've put any funding from the county-only side into their Impacts program. Everything has been funded either through the grant or through their TANF drawdown.
So then maybe the NCP, once you place that with an agency, it is the agency that receives the $1,200 for the training of? Am I understanding?
No.
Okay.
The up to $1,200. So what happens is, let's say they need work clothes. We would get an invoice. We would get the work clothes, send the invoice to the state, they send the money.
There we go. What happens if at the end of that, whatever amount of training, if it doesn't work out?
As far
As far as, say, I'm your NCP and you gave me all the help I need, but at the end of the day, I'm really not interested.
then they're discharged. And I do have one of our policies is that if you do leave the program, or if we have to drop you from the program, that you're done. It's a no reentry, it's a one-time deal.
Yeah, there has to be a bit of accountability.
Yeah.
Okay. Thank you.
Okay. We are now timelines, program timelines.
That's right.
Okay. And this is just a really basic kind of timelines. That when an NCP is referred to the program, the intake process will be initiated within 14 calendar days. Contact attempts made within 30 calendar days of the referral date to set up an appointment. If the technician is not able to reach or locate the NCP for a continuous 60, sorry, this paper is dark, it's hard to read the words. 60-day period through actively attempting to locate using different methods of contact, the NCP may be removed from the program. At the initial appointment, participants will have their cases reviewed for possible modifications. The NCP is expected to supply all necessary documentation within 15 days. If a modification is started, each case will go through a review process which will depend on the progress of the NCP. The case reviews with clients will start at 30-day intervals and be tailored by the technician or case manager per the NCP's need. The technician case manager will reach out 2 weeks after each case review to get an update of the NCP's needs with supportive services or referrals. A participating NCP can stay in the program up to 24 months as long as they continue to meet the criteria. So they're going to have to, I don't know if do you want me to go through the policies?
I don't think so, unless you want to just highlight, we're looking at it.
Okay, yeah. So there are policies for disbursements. So the intention is that the money will never actually go into the NCP's hands. It will go directly to the partners. That way we know that the money is always going where it's intended. And then there are going to be confidentiality agreements just to contain any, issues with other NCPs or, and then there are admittance policies. There are criteria to be admitted. You have to be in a located policy. We have to know where you are. There are, you have to be in a non-paying category. You have to be able to work. You can't have a Med 9. You can't be on Social Security. If you're not able to work, or if you have a barrier that we can't possibly remove, then you really can't be in the program. So there's going to be some hard decisions at times, but they're necessary. We have to be a good steward of the money that we're going to invest in people.
And if this program really works at the rate that it's working in Arapahoe County, who knows what's going to happen with the SNAP excess revenue that maybe we seem to see that 2026-27 funding is pretty much 2 more years. So you give an opportunity for the San Luis County to launch the program, promote it, and then work with all the partners that you have listed here. I like the list, and I think for 70 people, you might be able to place them on.
I think one of the biggest barriers that technicians run into is just maintaining contact with the NCP. That's the biggest issue we have in general, is locating and keeping in contact with them. These individuals, if they're engaged in this capacity and there's a tangible, incentivized piece to it, that might entice them to actually participate in the program and also to seek gainful employment. From what I can see in most of the current cases that we have, especially like in arrears cases, is that many of these folks are not just seeking disability, or they are not gainfully employable right now. So this program prepares them to be that. And I think that's where the disconnect really comes with like the workforce center. In fact, I just met with the state, the Colorado Rural Workforce Coalition director last Tuesday at the directors meeting in Pueblo, the Southeast directors. And we were talking about how there's been this clear disconnect between human service agencies and the workforce centers across the state. They're really focused on trying to rebuild those bridges, but there's an unclear pathway of how that's going to happen. And that's the biggest issue we have with our NCPs is that they're court-ordered to seek gainful employment. Getting them to the workforce center is where the challenge comes. Getting them employed is the challenge. And these four folks that are in front of you and legal counsel Nelson in court are the ones that are really fighting and advocating for the NCPs to do that. But there's been nothing in our county to incentivize them to actually go back to work and try to meet the mandates of their child support orders.
So what do you do with the potential partners? We are looking at the list here, and probably haven't met with yet.
I've met with several of them.
Okay, so I'm sure they're asking for some guarantees, you know, they're going to be training, they're going to be hiring, they're going to be so many things. And at the end of the day, the recommendation and referral comes from DHS. And if there is not continuity of communication and I would even go to the level of productivity. You know, because these all the companies that you listed here, of course, and there's more, and I go back to the same question, how are you going to make determination those that need retooling, re-education, so they can get retrained?
Well, it kind of goes back to your original, I mean, interrupt, but it kind of goes back to your original discussion of how many NCPs are we talking about,
Sure.
right? Well, we also have NCPs who fall under Colorado Works programming as TANF clients. Those clients do not, in this sense, we would not focus on those folks because these types of services and these types of incentivized payments are already available to those individuals qualified under those programs. So they can get work clothing purchased, they can get training, they can, I mean, we send them through GED if they need their GED, we send them through certification training through Colorado Works. So there's already that engagement piece that exists for those folks. These are the folks that are not qualified for that program, who are not able to access those types of resources, who don't have the ability or the support, both financially and administratively, from these folks to lift them back up. So that probably takes that 75 even down a little bit more, not a lot, but it also allows us to spread the funding a little bit further than where we're at right now.
Are you getting some pretty good feedback? I mean, the services, referrals, benefits, if you will. I mean, I guess if I was referring someone, this is pretty positive.
Yeah.
Yeah, I tried to really think, and I met with our team saying, you know, what do you guys hear the most? And how can we help? And so I tried to reach out to as many people locally as I could to say, hey, how can we work together to remove this barrier? You know, and this is kind of the list of stuff we came up with, and then I met with Michael a couple of times and came up with even more ideas. So how can we help these guys? You know, how can we get them back on their feet? And then, you know, like when they go to the workforce center, I met with Susan and at the workforce center and talked with her. And so our program, if they can pay their child support, like if they have a driver's license suspension because they haven't paid their child support. Well, if they pay their child support, we can reinstate their driver's license. And then they can go to the workforce center and get help because their programs, you have to have a valid driver's license. So if we can get them reinstated, then they can go to the workforce center and utilize their sources as well. So it's kind of like a stepping stone, you know.
The main thing is that there are so many unknown barriers for NCPs on a consistent basis that many people don't see as a barrier. And this program helps us eliminate those minimal barriers to help them start that process of regaining some self-motivation towards meeting their mandates and needs of their child support. Also, I think, you know, when Susan was with us as a workforce development, her greatest successes were in child support engagement, and I know the courts truly appreciated that specific position because it was that bridge that we were having that gap in. Without having that bridge right now, this program allows these folks to continue that pathway, but it's actually got additional funding that we were not bringing down to support Susan in that capacity. So this is another way for us to do that and bridge those services as needed.
There be an opportunity ever for NCP to become the custodial, the primary custodial if they get back in. And I know that's going to be courts and litigation, but there are any cases because we can use that. We have a good attorney.
I'll point to those two over there. They would know that.
Well, and what I'm saying is if that would be the end goal, to become now the main primary custodial person of that, or at least sharing custody, that would be a huge win in that program.
So I have them here to pay for supervised visits and mediation time so that they can try to get more parenting time. Because I feel that if they can get more time and invest more time in their children, they're going to want to help support their children.
You're onto something. I can't wait. We can't wait to see how the program evolves.
Why don't you want to touch on anything else in the presentation?
I like the way you close this. I mean, your last sentence. We want all NCPs to be able to say, I arose and made a difference in my child. Make it personal. Make it.
Yeah.
And I think that's the one thing judicially that I've seen with the cases, the way that they're handled. It's not to speak ill of the process, but there is a very clearly defined disconnect between an engagement with the NCP. It, to me, feels more punitive in nature in many regards, and it's difficult to engage somebody to be a part of that because the real goal is, like you said, it's engagement so that parent has parenting time with the children that they're paying child support towards. I think a lot of folks that are NCPs choose not to because there's a stigma with child support that's existed for many years. Because when you're not the custodial parent, you're the child support payment, and that pits parents against each other. We're hoping that this will also eliminate some of that bridge because there's not that I'm not getting child support payment situation going on, which causes that turmoil between them.
Yeah, I would love to change the narrative.
Yeah.
Well, that is an opportunity for both of them to contribute to bringing up a child.
Yeah, and I also found a place that we can refer to for co-parenting classes for parents that can't get along, that they can do it at 2 different times. And it's free, so.
Well, I'll tell you, this is exciting, good information. I mean, the cost, the next couple of years, there's still money there. Let's put it to work. Commissioners, any questions? Tina? Thank you.
Thank you.
We're going to go all the way down to section 7, consideration of caseload accounts and activity by program. We have the numbers. Commissioners, any questions on the stats? Would you like to highlight anything, Mr. Aragon?
No, the only thing that I just wanted to point out, and I don't know if Ms. Ringo's in the room, if she has anything to add, but the Adult Protective Service Division just held their annual ARD case review process this morning with the state. The state was here, and we thank them for coming down. It's an amazing learning opportunity for our caseworkers in APS to really learn the ins and outs of some of their, not only the assessment, but their care plans and other things like that. So I don't know if you wanted to add anything specific that we covered or anything that you want to address.
It is our best learning opportunity, and it is a good experience for us. This year, they picked a smaller sample, which at first I was excited to see, but it changes the statistics. So for example, they looked at our guardianship cases. They chose 4, they audited 3. 1 was perfect and got a perfect score. The other 2, they felt like we needed more documentation in one area on both of the other 2 cases. So when we get those findings back, unfortunately, it's probably going to be 33% compliance because they only chose 3 cases.
See, next time actually that they do 10.
Yes, that's a lot better odds. And so anyway, we were excited for that. And then they looked at 1 case on the beginning of getting a referral, intake, investigation, and then care planning. And that case also scored perfect, so we were excited for that. Then they looked at that case and 2 other cases for care planning, and again, one case we missed 3 out of like 17, 18, the other one we missed 6 out of 20. So some of them were the same questions, so we have some learning to do. And I think that just goes to show when we have turnover in staff, it always starts our clock over retraining and learning for staff. And these jobs are so complicated and so complex, and the detail that they want in documentation is vast to where we have to, it takes time to train new staff. So.
I think one of the important discussions we had this morning around the training part of it, though, is the concern that I've expressed multiple times locally and with the regional directors, and made this clear to ARD this morning, is that when the state trains in the APS Academy, it's an online platform now. And essentially it's an individual who's communicating via a Zoom call, such as we're on now, to the case managers, the content of what an APS caseworker should do. The concern that I've always had, and I've shared with the regional directors, is that from an educational standpoint, there's no classroom pedagogy that exists in the current delivery of that information. And the state policy in ARD, and it was shocking to me this morning when I made that comment that ARD said, I don't think we've ever had anybody with educational background to think beyond that scope, which, I mean, that's understandable. It's not in their wheelhouse. But from that perspective, if you are completely disengaged as a caseworker in those trainings, then how are we sufficiently training staff to go out and do the work that they do, right? So that's where my concern lies. And so he's going to take that back to policy. I'm also going to make that recommendation to policy at the state level regarding hiring or consulting with an educational subject matter expert in the delivery of those trainings, because we are not, what the training that the case managers get to do the work effectively that they do now is down here at the ground level. It's what Ms. Ringo is teaching them as a seasoned APS case manager and supervisor to do that process. And when ARD is assessing us on that, is it the fault of the case manager for that, or is it the learning barrier that was created because there is no interaction? We also discussed the difference between in-person versus virtual, because we know that different learning styles require different mechanisms. So there's a lot of things that I think the state needs to still investigate in these before the scoring system becomes the primary focus of what accounting is doing correctly.
They recognize that you mentioned not only the pedagogy, but recently there was some new research is the anthropological educational perspective for adults.
Yes.
The anthropology of learning, and so from that, stay with them. And since it's a program sponsored by the state, they can partner with CSU, with DU, and all the educational facilities to develop a curriculum that is, whether it's online or face-to-face.
Yeah, I think there needs to be some.
And I think too, we also talked about, they go to academy in their first 3 to 4 months of employment. And so they don't have a lot of experience to retain or apply the knowledge that they're learning too. We need to have refresher trainings. Like every year, there should be a refresher sponsored by the state. And they do some little trainings in quarterly context, but it needs to be intensive like that so that they will retain it. So, and then our assessment tool is changing. So we learn to do something well, and they're changing it. So.
That's life, right?
Yes, yes, yes. That's the only thing we can guarantee.
Well, thank you.
Thank you.
Thank you. And you know, Tina, I was looking at the number of child support services. There's a great opportunity to actually, on the collections that take place, whether it's monthly or quarterly, to really increase that. So we're looking forward to seeing the results of that. Anything else, Mr. Aragon, under Section 7?
No, Commissioner, not at this time for consideration of case of accounts.
Commissioners, I will entertain a motion to approve approve 7A with subsections 1, 2, 3, 4, 5, and 6.
I'll move to approve the caseload counts and activities by program for June and July.
Second motion.
Commissioner Lucero,
Yes.
Commissioner Hess,
Yes.
Commissioner Lopez.
Yes. 7B, consideration of proclamation, August is Child Support Awareness Month. Mr. Dorncamp, come and take a video out here.
Commissioners, Ms. Abigail Durankamp will read our proclamation as August is declared by our governor and by national statute the Child Support Awareness Month. So,
Give me just one quick second. He's going to come all the way to the front. Up here. Go ahead.
Child Support Awareness Month for today, August 19th. Whereas Los Animas County recognizes that each child matters and joins the nation in recognizing August as Child Support Awareness Month. And whereas child support is a vital source of income for households in Los Animas County, many of them low-income families. And whereas strengthening families improves the lives of children by promoting their safety and well-being and provides economic security. And whereas Los Animas County applauds the parents who support their children and make child support payments consistently to care for them. And whereas child support professionals are important assets to the county, working in collaboration with parents and other community partners to ensure that the children and families receive quality services. And whereas it is important to increase public awareness of the child support program through outreach and education to reinforce the position that all parents must take responsibility for the financial, emotional, and physical support of their children. Now, therefore, be it resolved that the Board of Commissioners of the County of Los Animas, State of Colorado, proclaims this month of August 2025 as Child Support Awareness Month and encourages all citizens of Los Animas County to work together to make our children's future stable and bright. In witness thereof, we have affixed our signatures for you today.
Well, thank you very much and congrats.
Commissioners, all of you have any questions or concerns you have regarding Child Support Awareness Month?
No, thank you.
That's what by the way, the treats that you were all going to deliver today.
We'll bring to that.
Cake pops and candy.
Yeah.
Very good. So, Commissioners, I will entertain a motion to approve item 7B.
I would move to approve the consideration proclamation August is Child Support Awareness Month.
I'll second it.
Commissioner Hess,
Yes.
Commissioner Lucero,
Yes.
Commissioner Lopez.
Yes. Section 8, financial matters, consideration of financial bills for July 2025. Madam Director, Finance Director.
For the month of July, our expenditures were $91,218.16. On the statement of expenditures, revenues, and county shares, I just want to bring to your attention that the numbers do look a little off as far as the year-to-date expenditures. Due to the close of the state fiscal year, they had to move some of the expenditures around to different fundings. For instance, if the core 100% was all used up, they moved some of the expenses to the 80-20. So
Yeah, your employees' journal entries to reconcile the factors.
right.
Thank you.
Is there any questions on either one of these?
I do not have any questions, Commissioners. No questions, I'll entertain a motion.
I'll move to approve the financials and bills for July of 2025.
Second motion.
Commissioner Lucero,
Yes.
Commissioner Hess,
Yes.
Commissioner Lopez.
Yes. 8B, consideration of payroll for pay dates July 15th and 31st of 2025.
For July 15th, 2025, the payroll expense were $124,853.60. For July 31st, the expenditures for the payroll were $123,923.41. We do have an addition where we added one of our 1099s because we are doing it through the payroll system. So the 1099 amount is $6,990.53.
Thank you. I was going to say, from one month to the next, a bit of discrepancy. Thank you for that.
Yes,
Very
we
good.
separated them out.
Commissioners, any questions? Hearing none, I'll entertain a motion.
Move to approve payroll for pay dates July 15 and 31st of 2025.
Seconded.
Commissioner Hess,
Yes.
Commissioner Lucero,
Yes.
Commissioner Lopez.
Yes. Thank you. And we do not have any other items on this agenda, so I will entertain a motion to adjourn the Los Alamos County Board of County Commissioners acting in the capacity of the Board of Human Services.
So moved.
Second motion.
Commissioner Lucero,
Yes.
Commissioner Hess,
Yes.
Commissioner Lopez.
Yes, thank you all. Great afternoon, and I know there's now a couple of opportunities.